Hello, everybody. Welcome. This is Joel Kahn, medical doctor, triple board certified preventive cardiologist, and your host of this week's episode of HeartBrief. We're going to look at three interesting articles, hopefully some relevance to you and your patient care, and you'll walk away just a little bit refreshed with brand new literature. So let's go over to the share function and start with a article that I found quite interesting, although very advanced. This is from BMC Pharmacology and Toxicology, just published, exploring the impact of endocrine disrupting chemicals on erectile dysfunction through network technology and machine learning. So, endocrine disrupting chemicals, basically plastics like phthalates, BPA, PFAS, PFAS, we've all heard of them, and they're everywhere. They're forever chemicals. The plastics that are in our bloodstream, and now we know they're in the plaque in our arteries in our brain, and they've actually been shown to be in our penis and our testicles. Oh my. Well, this was not a clinical study. This was a machine learning study looking at a potential of 186 targets via which endocrine disrupting chemicals might contribute to erectile dysfunction and what the clinical implications might be. I encourage you to look at it. It's a very sophisticated article. Maybe I should point out it was just published, but they are hiding the date for me. I'm sorry. But I actually want to go to the conclusion because the level of analysis was so sophisticated. The conclusion was this study elucidates the potential mechanisms linking exposure to endocrine disrupting chemicals with the onset of erectile dysfunction, providing valuable insights for environmental health research and public health policy making. And it goes on to final conclusion. These findings highlight the urgent need to reassess the health risks associated with endocrine disrupting exposure and offer a theoretical foundation for developing effective strategies for erectile dysfunction prevention and treatment. So, what we're talking about, of course, is avoidance and then possibly removal of some of these chemicals, even though they have the reputation of being forever chemicals. Avoidance by avoiding plastics and certain fragrances and colognes and air fresheners, avoidance by not drinking in plastic bottles and microwaving, and all the modern approach to living life in 2025 and beyond. So hopefully, men will listen to this. They'll listen at a young age and they'll avoid the problem of erectile dysfunction. Now, I mentioned removal. There's some data that hot sauna can remove some of these toxins, something called therapeutic plasma exchange, which is a very expensive cash-based approach to removing toxins, and possibly other approaches like even chlorella, a natural chelating agent. All right, so let's go on and see if we can look at a second study after learning how much it is important to avoid endocrine disrupting chemicals in our body. We're going to go over to Nutrients, a journal, and we're going to look at a paper just published November 25th, 2025. The effects of 4 weeks of alternate day fasting with or without protein supplementation, a randomized clinical trial done in Singapore. So there is a lot of interest in various forms of fasting, and one of them that's been published is every other day eating either no calories or far fewer than average calories, alternate day fasting. And that's what they looked at, and they looked at what happened to body composition in healthy volunteers in 4 weeks, but they also looked at muscle mass. So they were allowed these human subjects, 20 of them, to eat whatever they wanted to on one day and then reduce their calories to 400 to 600 calories a day on the second day, eaten in a narrow window, 12 to 2 p.m. They did that for 4 weeks. The group that was doing the alternate day fasting on the day that they had reduced calories every other day, they did 25 grams of whey protein as an approach to try and preserve muscle mass during these 4 weeks. What they found was that there was weight loss during the 4 weeks, 2.4 kilogram, about 5 pounds in 4 weeks. There was fat loss, 1.6 kilograms in 4 weeks. But unfortunately, there was also fat-free mass loss. That would be muscle. You're not going to lose your bone, you lose your muscle. And it did not matter whether the subjects were on the extra whey protein supplementation on the alternate day or not. It simply didn't protect their muscles. So their conclusion was short-term alternate day fasting effectively reduced body fat and fat mass, but it also reduced muscle mass. And this reduction was not attenuated by protein supplementation during fasting days. So we know that a level of current discussion going on is how critically important muscle mass is. Some people call it the organ of longevity. Not everybody agrees with that, but it's a popular term. And we know that fasting can create both fat loss and muscle loss. So far, I continue to teach my patients about the 5-day fasting mimicking diet by Dr. Walter Longo, which has data that it does not lead to muscle loss and only weight and fat loss. So that is my suggestion, and it's only 5 days in a row, and it's what I like to teach my patients. Okay, one more hopefully interesting study you'll find that is also practical and a bit unexpected, and this is a study on sleep. This is in the journal Open Access, and this was just published. Again, the journal is making it difficult. There we go. September 30th, 2025 was accepted. It's actually just published, November 29th, 2025. And this was an evaluation in adults in China that had insomnia and needed some therapy to get to sleep. There were 200 adults. They were randomized, interestingly, to either an accepted treatment of insomnia, which is cognitive behavioral therapy for insomnia, or CBTI, or they were taught and performed Tai Chi, a traditional slow-moving exercise that they could do for relaxation. And interestingly, the winner here was actually that Tai Chi was as good, at least, as the accepted gold standard around the world, cognitive behavioral therapy for insomnia. The conclusion, Tai Chi was inferior to CBTI at month 3, but non-inferior at month 15. This finding supports the use of Tai Chi as an alternative approach for the long-term management of chronic insomnia in middle-aged or older adults. Interesting study because, patient of yours, even those of you listening and myself who have any difficulty sleeping, can easily find instruction in Tai Chi online. These people were actually taught through a certified trainer in Tai Chi, but there's plenty of online capability of learning how to do it and then continue to do it. It was at least 1 hour twice a week for a total of 24 sessions of training versus the cognitive behavioral therapy, which involved one-on-one, an hour a week, twice a week for 24 sessions of relaxation therapy, stimulus control, sleep restriction, sleep education, and cognitive therapy. So next time one of your patients says, "Doc, I've tried everything for sleep, and I'm tired all the time, and I'm up all night long, and I've even gone to a therapist and certified in CBTI, cognitive behavioral therapy for insomnia, and they've been through all the natural supplements and anything else you can think of, all the sleep hygiene. Now we can pull Tai Chi out of our therapeutic toolbox and offer it to patients based on a randomized human study." So interesting discussions this week on HeartBrief. Thank you for visiting Joel Kahn, medical doctor in Detroit and Boca Raton, Florida offices. I'll see you for the next session of HeartBrief. Please share this with your colleagues.